Hi everyone. As I'm sure you already know, my name is Dr. Uri Burstyn, and this is Miss Claudia, and we are here today to talk to you about cat stuff. Well, cat medicine stuff to be specific. This video is a follow-up to my video on hyperthyroidism. As many of you probably know, I just made a series of 3 videos on the 3 most common old cat age-related diseases. So kidney disease, hyperthyroidism, and the lymphoma inflammatory bowel disease syndrome cluster. So in my hyperthyroidism video, I talked about managing and diagnosing hyperthyroidism. And one of the things I talked about was giving your cat transdermal medication. So medication that gets absorbed through the skin so you don't have to give your cat a pill or liquid meds. Now, I do have videos on my channel about how to give a cat liquid and pill meds, which you should check out because that is a pretty important skill for every pet owner to have. But it's kind of awesome that we have this option of doing transdermal medication for some medications. Now, not every type of medication can get absorbed through the skin. A lot depends on the pharmacodynamics of the drug involved, but some can be. And the most commonly used transdermal medication is methimazole, which is the drug that's used to treat feline hyperthyroidism. Pretty cool, right? And particularly as many of these cats end up needing this drug for life, it's really a nice option to have. Now, before we get any further, please remember to squish that subscribe button and pet the bell notification icon so you guys can see more of me and Claudia and get more helpful tips. And please remember to share this with anyone you know who has a cat, who is a vet student. Spread this around because this is an important thing for every cat lover to know about and a really important tool for managing cat welfare. With that said, let's have a slightly deeper look at transdermal medication. And for this video, we're going to use Creature, who's one of my clinic cats. She lives in one of the vet clinics that I run. And she has hyperthyroidism, and she was a star of the hyperthyroidism vid. So she's going to help us demonstrate how to give that medication. And Claudia is just going to hang out and look cute. Here's little Creature getting ready to work with us. Step 1, as with any time you're medicating a cat, is to make sure that they're nice and comfortable. I really do recommend incorporating any medication routine you have into something pleasant, like having a little grooming session with your cat or their meals. That way they have a nice routine. You can give them medication right before you feed them, or you groom them after you give them medication. That way, even when you're in a hurry or in a rush and only have time to give them a quick pet, cats will be nice and relaxed anytime you need to give them the meds. And even in those times that you're in a hurry, you should be able to just give them a little pat, give them the meds, and they won't mind it too much. And we just want the cat to enjoy the medication process. And of course, with transdermal medications, the process is relatively easy, but we should still make it as pleasant and routine as possible, both for your welfare and your cat's. Now, for transdermal medication to work, it has to be applied to hairless skin. And in a cat, the most reliably hairless area of skin is just right here on the inside of the ear. And in most cats, we will have 2 ears with which to work with, which gives us 2 areas for medicating. One thing to watch out for is that when you are doing this on a regular basis, you can get a little buildup of oily gunk on the skin. That is why we alternate between ears, between administrations. And if you see a little residue there, you can just gently wipe it away with your finger or a cotton swab. And you always want to keep track of whether you're doing the left ear or the right ear next. The skin looks nice and clean. The patient is nice and relaxed and well petted. Now let's have a look at the methimazole pen. So this is a transdermal medication pen. You see the name of the medication is on there, as well as the concentration. That's the dose per click. It says 2.5 milligrams for 2 clicks. That means that if you want to do 1.25 milligrams, you do 1 click. If you want to do 5 milligrams, you do 4 clicks. And so we take off the cap. Let's be quite careful not to get this onto our skin. The tip here looks almost like a little highlighter. We were going to do 1 click, and a tiny bit of gel will come out the end. Now we're going to turn out the ear and paint it on with 1 or 2 strokes, just like that. Nothing more. You don't really need to rub it in. You can see Creature's yawning because she's so bored by all this, because it's all so routine. I'm going to do it one more time just so you can see from a different angle. Turn the ear out, smear it on in one little swipe. Isn't that a nice way to medicate a cat? Actually, cats yawn when they're not quite sure what's going on. So she's just a little bit confused as to what all this fuss is about, which is still much better than her fighting us tooth and claw. So that's how easy medicating a cat can be if you get a transdermal medication. And again, this is not a replacement for all medications, but it can certainly be a replacement for some. You don't mind that too much at all, do you, creature? Thank you very much for joining me for that video. I hope you found it useful and helpful. And more fun than Claudia is finding this. Have a great day. I'll see you next time. Claudia, will you see them next time? Yes.